Perfect. Thanks, Amy. So welcome, everyone. My name is Teo Douglas. I'm a TELUS Health business analyst for our Med Dialog project. So I joined TELUS Health 5 years ago as a part of our technical support team for our MedAccess EMR in BC. I spent time in escalations and our fiber internet team, so coming back to work on our Med Dialog project has been a great experience because I've been able to kind of take that customer feedback that I've heard from our clinics and use that to help improve this product. I do also have on the line today Ryan Everett, who is one of our Wolf EMR experts. So he's going to help me out in the chat as questions come in. If there's anything that he's able to help answer that I'm not able to cover, he will be there as backup. We do also have Sunny Saul available as well. So lots of TELUS support for any sort of questions that come in throughout. Today we'll be discussing streamlining your clinic's external communications using Med Dialog with integrated eFax. I have a few slides to go through to explain what Med Dialog is, how it works together with our integrated eFax, and how the two together can save you time and money on your external communications. We'll have a demo showing how a Wolf user can send a Med Dialog message to another Wolf user and how the response comes back seamlessly. And as Amy mentioned, I'll stop for a few opportunities for questions, but feel free to use the chat functionality at any time. All right, so what is Med Dialog? Med Dialog is a secure messaging solution to communicate between providers using your existing EMR workflow. You're able to send an unlimited number of messages for a flat rate, whether those are Med Dialog messages or TELUS eFax messages. So there's no worries about overages on either plan when bundled together. All communication is kept within the patient chart using an integrated workflow you're used to today. In Wolf, we integrate our TELUS provider registry address book, which I'll show in our demo shortly. Med Dialog supports sending full resolution attachments with support for documents, audio, video, and other file formats. In simplest terms, it basically means whatever quality you send is exactly what the other end receives. There's nothing grainy or blurry. If you send color, they receive color, and if your document has any selectable text, that'll come through on the other end the exact same way. If your recipient isn't on the Med Dialog network, we do have our TELUS eFax solution to automatically package and send your message as a fax without any extra clicks. So Med Dialog with eFax is supported in Wolf 2018.2 and newer, which your clinic should be on today. So why did we create Med Dialog? We wanted to create an open network that supports patient care dialogue between physicians, specialists, and other health providers. We currently support physicians, specialists, and any allied health professionals in your clinic using the Wolf EMR today, including nurse practitioners, MOAs, other office staff, and so on. Everyone can send and receive messages on Med Dialog or eFax, and for any MOAs or support staff, they can send messages on behalf of the providers registered on the Med Dialog network based on their EMR permissions. Today, Med Dialog is fully integrated with PS Suite, MedAccess, and Wolf, which represent the majority of our TELUS Health user base. And our Quebec EMRs, Medisync and Kinlogics, are joining our network later this year. So essentially today, everyone that's either using PS Suite, MedAccess, or Wolf can all send to each other throughout the Med Dialog network. We're beginning to expand our network to external partners, starting with one that we'll discuss later. We're also expanding Med Dialog to integrate with other networks to create a larger connected ecosystem outside of TELUS Health. When we were individual EMRs, this kind of solution wasn't possible, but with the backing of TELUS Health, we now have the capacity and the users to start to build this out. So we know that obviously you'll want to be able to message outside of your EMR and outside of TELUS Health, so we are starting to work on building that. We know that providers are communicating with so many different endpoints and portals constantly, so we do actually want to eventually integrate those portals and give you the ability to kind of manage your external communication through these portals all through Med Dialog. Again, a lot of that is future vision. So in the diagram here, we show that currently we support sending between physicians and specialists primarily, but we are building that out further. So I know it can be a bit hard to wrap your head around this. So a real-life example we like to use is kind of Interact e-transfer, which supports sending money between multiple banks with a single workflow. So if I want to send money from my Scotiabank account to a friend's CIBC account, Interact facilitates that transfer. So what Med Dialog is doing is aiming to kind of create that same type of open platform where Med Dialog is the piece that facilitates that communication with other doctors using any EMR platform, and you won't have to worry about how that delivery is done. So let's go over the typical Med Dialog messaging workflow. Let's pretend you're sending a referral letter to a specialist. In your EMR, you'd access that patient's chart, you would create that letter, and you would print it. So with Med Dialog, you'll still follow those same steps, but instead of printing at that last step, we've created a new send button right in your existing workflow, which I'll be showing shortly here in our demo. We know that at first, most recipients won't have Med Dialog, and our industry is obviously built on fax. So when you click that send button, you won't have to think about how it's sent, because we're going to take a look at the recipient provider information that's in your address book, and we'll automatically send it over Med Dialog or eFax accordingly. So if the person you're sending to is on the Med Dialog network, we'll take note of that. We'll send it by Med Dialog in full quality, selectable text with the full information. If they're not on the Med Dialog network, we'll package that into a fax and deliver that via TELUS eFax to the fax number that you have on file. If both providers are on Med Dialog, when that provider replies to your message, the response comes back into your EMR and is automatically attached to the patient chart if the discussion was around a patient. So this creates a message thread, which allows you to track and facilitate conversation when multiple providers are involved. If you're sending to another clinic that hasn't seen that patient before, Med Dialog attaches machine-readable patient demographic information in an electronic format so that the receiving end can actually create a patient chart with the latest up-to-date demographic information pre-populated from your message. The same applies if you receive an incoming Med Dialog message with a patient your clinic hasn't seen. So this is really cool because if you're sending patient information, let's say to a specialist, and that specialist has never seen this patient, the demographic information will come through electronically. So the specialist MOA won't have to manually enter in that patient's name, phone number, address. All of that information will come through electronically, and they'll be able to click to add that to their EMR, even if you're sending between different EMRs. So let's say you're sending from Wolf to MedAccess or MedAccess to Wolf. That patient demographic information still comes through electronically, and you can attach that into your EMR. So let's go over integrated eFax, because this is a new product for our Wolf EMR customers, and we're excited to launch it and help make some pretty big improvements to how much time you spend dealing with incoming and outgoing faxes. On this slide, we go over a few key points of how integrated eFax improves the faxing portion of your communication. So at a very simple level, eFax is sending your clinical faxes over the internet instead of having a phone line in your clinic hooked up to a multi-purpose fax machine. eFax allows you to keep your current fax number, but port your number to our TELUS eFax solution and have the option then of saving money in hardware and supplies for that multifunction fax machine, and recurring costs because you no longer need to pay a local service provider like TELUS or Shaw for monthly service for that fax line to maintain that physical fax machine. So again, you do have the option of completely giving up that fax machine. You can port your number to eFax and no longer pay for any sort of paper, machine maintenance, or pay for a fax line running to that fax machine. So lots of cost savings there. You never have to worry about your line being tied up or sending multiple faxes at once because digital faxing supports simultaneous sending and receiving through eFax. eFax is fully integrated to Wolf so that incoming faxes arrive in your documents and outgoing faxing is done in your EMR by selecting any provider in your address book that has a fax number entered and just hitting send instead of print. You can also fax from Microsoft Word or other applications outside of your work desk in the Wolf EMR environment using what we call our print driver solution, which I'll show a bit later in our demo. So essentially anywhere in your EMR where you would print today, you can now send via fax. You can verify that your faxes have been sent successfully by viewing the message status built directly into a new fax queue directly in your EMR, which I'll be showing shortly. Integrated eFax is an essential piece of external messaging with Med Dialog because the two work together to send your message using the best method possible. Again, if the recipient is on Med Dialog, we'll send it out via Med Dialog, but if they're not, this is kind of the fallback solution, which we expect to be the case for a lot of the providers for the short term here. We do understand that some of you may be using an electronic faxing solution today, but where TELUS integrated eFax sets itself apart is a level of integration into your Wolf workflow and having the provider address book integration to automatically set the destination fax number based on the provider from your address book. These are some of the facts around the challenges we're looking to tackle with Med Dialog. So with faxing today, there's very little traceability, whereas when you send electronically via Med Dialog, it allows you to confirm receipt and kind of keep track of that message a bit better. If you think about the amount of time you spend calling or even mailing specialists and how sometimes that communication is lost, we've actually done a bit more research on this and found a study where 21% of requests for consultation never received a response. So with Med Dialog, if both the sender and the receiver were on the Med Dialog network, you would have a delivery receipt and peace of mind knowing that the item is in their EMR awaiting their response, rather than lost in, say, like a pile of faxes. We do have a similar kind of confirm of delivery with our eFax solution as well, but the problem is we can only confirm up to a certain point. Once it reaches their fax machine and they pick up that fax, we can tell you that that much has happened, but anything past that, we have no visibility into. So whether or not that was there a paper jam and the fax didn't come out, or if there was another issue, this is really where Med Dialog shines, because we can know that that Med Dialog message was delivered, it was picked up in their EMR, and is awaiting their review, and is already assigned to the correct person. So this really does help improve communication between providers, because the recipient provider has kind of full visibility into that message without having to deal with faxing. So in many cases, patients aren't just seeing one provider. Some elderly patients can have up to 5 providers involved when considering allied health professionals and others. Med Dialog message threading allows everyone to follow the discussion so that all providers can see all messages to date. In this example, we just show the difficulty of managing communications and how a collaborative discussion is more beneficial to patient care, because your focus should be on that patient care, not on figuring out how to talk to everyone. So in Med Dialog, we allow you to send messages to one primary recipient and up to 9 CC'd users. So you can actually have 10 people in the go all at once. And anyone that sends a message, it does still send like the full context with it. So if you think of like an email thread, all of the different messages through the discussion are attached for everyone to view at any time. And you can also loop in eFax users or just regular fax users as a part of those 10 recipients. So you can send to a mix of Med Dialog recipients and eFax recipients. So you may have 3 of the 10 on the Med Dialog network, the other 7 you may want to fax to. Again, the possibilities are kind of endless there versus having the one single fax number to send to. So I should probably stop here for questions before we head into our demo. I've seen the chat is going there, and thanks, Ryan, for your help.
Yeah, Ryan.
Was there any questions?
There's a few, and I think a lot of them you're going to be covering when you do the demo. But one of them that came in to make sure to kind of go to, I think, when we do the demo is when they receive documents or messages with documents in them through Med Dialog, do they have the opportunity to assign a document type and keywords to it when it comes in, and how would they go about doing that?
Yes. Yeah, we can run through that a bit in the demo. But yeah, keywords and all that can be attached. If something comes in by eFax, it comes in just as if you had scanned in the document yourself, then you can go through that full same workflow. So yeah, I'll see if I can touch on that if I have that set up in our test environment.
Yes, and if we don't touch on that, don't worry, we will write out instructions and a screenshot in our Q&A. The one question is does Med Dialog work to transfer charts? So if a patient's going to a new provider, can you just send their chart?
Absolutely. We have 2 different ways of doing that, and I'm going to kind of show both during our demo. But just to kind of give you an upfront explanation, Med Dialog supports sending that patient demographic information as discrete data. So like I was saying, if you were to send that chart to another Med Dialog enabled provider or clinic, you could actually send all of that demographic information without them having to retype that out. Anything outside of that demographic information today is sent as a packaged PDF. So we know that's obviously not ideal, and we do want to work towards having a more kind of discrete data exchange, or like a full reportable, graphable data kind of set sent over. But today it is packaged as a PDF. So there's 2 different ways of doing that today, though. We can either eFax that chart out, or we can send that out via Med Dialog and attach whatever parts of the chart we'd like. So I will go through that in the demo.
Perfect. And then there's a lot of questions about when we send messages, can we attach multiple things like labs and results and all that kind of stuff?
Absolutely, yeah.
I
think that's the best. I'll show that one. That's best to see. So, that's the demo.
And we do have questions coming in about bundling and pricing and how does it, so all those, we are going to address those in a separate section, just so you know. So hold those questions about pricing and bundling and what can you have and not have and choose to have, those will come up. Okay, so I think we're ready to move on.
Absolutely, yeah. Yeah, we'll stop for pricing near the end, and I'll make sure to stop right after for questions as well to answer any sort of pricing questions around that too. Okay, so let me just change things up here, and I'll just share another monitor. See if I can, 1 second. Share screen number 1, and that should hopefully. Amy, are you seeing the Wolf EMR set up here?
Yep, looks good.
Okay, awesome. Okay, so I'm in one of our test demo environments here. So obviously the information you see is not kind of factual. I'm just dealing with test patient information, but I'll do my best to kind of run through things here. So I'm logged in as a Wolf user, as a doctor, so I'm going to open up my work desk to start. And the first thing I'm going to show you guys is a new section that we built out for Med Dialog specifically called your external messages. So I'm just going to hover my mouse down here. Is the screen resolution okay, Amy? Are you able to read like kind of where my cursor is?
And just so everybody knows, above the window where you can see his screen, there's a little magnifying glass. So if you do want to, you can use that to zoom in. Okay, so yep, you can go on.
Absolutely. Okay, perfect. Yeah, so we've just highlighting, this new section here for external messages. So this link is here for any Med Dialog enabled user or MOAs that work on behalf of the Med Dialog user can access this new external messages here directly from the kind of the home page of the work desk. So I'm just going to open that up and show you this new window here. So this is very similar to kind of how your email inbox would look or something like that. So this is for any incoming Med Dialog messages. And for these, there's kind of 2 ways you can receive a Med Dialog message. If it's related to a patient that you've seen, that will automatically attach the patient chart and be accessible there. Otherwise, we can also access these from within the external messages here within the inbox. So kind of different ways to access the messages. In this example, I'll probably mostly work out of that inbox just because we don't have a ton of patient information set up in this environment. But just in here, one of the first things I want to highlight that I mentioned earlier is what's called our TELUS provider registry. So I will go through kind of the whole demo of this, but I just want to highlight this provider registry because I think it's kind of a key foundation to understand how the Med Dialog network works. So I'm going to open up this address book here. And so obviously your clinic is probably used to dealing with your local address book today. And so what we've done is we've actually created kind of our own central address book called the TELUS provider registry. And so what this TELUS provider registry is when you sign up for Med Dialog, we vet the information of every single doctor or specialist on our network. We'll go through on registration and collect information with the latest address, their latest fax number, their registration information to confirm that they are who they say they are, and really vet kind of that they are the person that you're seeing in this list. So we're maintaining that list of this TELUS provider registry. So again, the list of doctors who are enabled for Med Dialog and can be sent to as a part of the network. So as you have doctors join your clinic or leave your clinic, we will add or remove those doctors from the TELUS provider registry. And so let's say you're a doctor that is working at a clinic for 4 months kind of thing, and then you're going to move to another clinic. We can then change your information in the TELUS provider registry to send your Med Dialog messages to the new EMR. So those can kind of follow you without everyone having to update a fax number in their address book and change all sorts of information for you. So this TELUS provider registry will search your province by default, but you can send between provinces if you're on kind of near the border. And so in here, just going to show, for example, we've got a user set up. And when we search for a user, what this is doing is this is searching a combination of our local address book or our local consultants and the TELUS provider registry. You'll see this column is probably new. So what we see in here is these fax numbers or the fax icons will show any user that has a fax number entered. So anyone that has a fax number entered, it will be considered an eFax recipient so that you can send to them via eFax because they've got that number in there. For anyone on the Med Dialog network on the TELUS provider registry, you'll see this little envelope with the purple plus sign, which shows that they're enabled for Med Dialog. So these are users that we've vetted and gone through and added them to the health provider registry, and so you can access them there. So in this example, we've got the same user listed twice because this user is at multiple addresses or multiple clinics. And so in here as well, I can go in and set these as either clinic or user favorites. And when you do so, they show up obviously in your favorites tab. So this is the TELUS provider registry, and again, totally integrated into your existing kind of address book that you have today. I know this is a bit of a different way of displaying it. It's a bit more graphical, but this is totally integrated and accessible with your current workflow. I'm just going to go ahead and back out of that and go through a bit more of this new external messages screen, because I know that this is brand new for Med Dialog. So in here, you have the options of creating a new message, replying to an existing message, archiving a message, which just puts it into another status of archived, printing, or accessing your address book. I'm going to go ahead and show the new message screen here. So I'm going to click on that new message. You'll see that this right-hand section has changed. And so in here, the first thing I want to highlight is this on behalf of. So right now I'm logged in as a doctor, so I don't have this set. But if I was an MOA user or support staff, this would be checked by default, and I would have to select who I'm sending the message out on behalf of. Because again, MOAs, office managers, and let's say like registered nurses will not be registered on the TELUS provider registry. They'll have to send on behalf of someone that is registered. So they would choose whichever user here and send on behalf of them. So in here, I've got my to, so I can click on this to button and it pulls up that same address book we were already looking at. And in here, I can go through my consultant list. These are all my favorites. If I scroll down to the bottom, I had this user we had looked at before. So I can double click to add them as a to user. And then I can, again, as I said before, add up to 9 CC'd users in here as well. And I can do a combination here of sending to fax users, Med Dialog users. You can kind of combine. The only users we're not able to send to are ones that don't have an icon here because this user does not have a fax number entered. Just going to click OK to that. That pulled in my recipient. I have the option of adding a subject. I can add a message down here. And then there's some other information in the middle here. So we've got, we can attach patient context. So just to give you a bit of a heads up, I don't think this scenario would be used a lot because most of the time you would be sending a Med Dialog message from within a patient chart already. But just for the example of this workflow, I'm going to pull up a patient and show you how you would attach that information if you chose to. This would be a good example of how you could send an entire chart through Med Dialog. By selecting the patient, attaching their chart information, and hitting send to send that PDF off. So again, I'm going to click on this patient button, and it pulls up our search window. I'm just going to pull in a recent patient that I've been working with. And so it shows all the demographic information. Again, this information is sent through as discrete data. So the other end will receive the address, the phone number, the full name, the PHN will all come through without the MOA having to retype out that information from the PDF. That comes through electronically. And then you'll see this attachment and these new buttons that have appeared up here. So the first one here is to attach patient's documents. So you select a patient first, attach any documents that are associated. I have the other option here of attaching a patient's chart. So I'm going to click to show that. When I click that, it pulls up kind of the ability to check off whatever information I want to attach. So I'm just going to check off all medical information for this patient. You can see that it dynamically creates that, and then I'm going to go ahead and click OK. And we'll see that that's attached itself as a PDF document. And again, if I'm sending this to another Med Dialog recipient, so this user is on the Med Dialog network, this PDF comes through as full quality. You can highlight and select text inside of it, and you'll have the full access to that PDF in full quality. And again, this information is sent as discrete data. I'm going to discard this message for now and just show you kind of an example of a message thread. So I've sent this one previously here, and I'm just going to kind of pull this up to show what this looks like. So I sent this message to that same user, and I just said hello. And then I had a response 13 minutes later that said, thank you, this is a response. So in here, I didn't attach any patient information at all, but I can go through, I can reply, and continue this thread accordingly. So that's basically the full thing here. I guess the other thing I just want to highlight is just this little green check mark here. It's a bit hard to see here, but if I access my sent messages, you can see that a bit better. But we've got this message status here showing sent messages successful. So you can track the status and ensure that that message went through to the other side. In the majority of cases, if we aren't able to deliver that Med Dialog message, you'll get a kickback right away in most cases. In some cases, there may be a bit of a delay if we try and send to the clinic and the clinic does not pick up the message because that user is not there or something similar. We can definitely kind of accommodate that and take a look into that. But again, in most cases, that will kick back right away. So that's basically the full external messages screen. From here, I'll jump into sending a referral.
Do we want to answer just a few questions specific to this one before we move on?
Sure.
Yeah, I was just saying, so we have some questions about the address book. So one of them was everybody who appears in the directory, are those all people who are on Med Dialog or also others?
It's a bit of a mix. So in your address book here, you'll have a mix of your local address book, but anyone that's on the TELUS provider registry will be mixed in if you choose to check off that box. So if you check that box, you'll search both the TELUS provider registry and your local address book. So you have the option of either just searching your local or including the TELUS provider registry. But again, if you want to send to someone over the Med Dialog network, we do recommend searching that TELUS provider registry to get their latest up-to-date information.
And there was also questions about, say if their fax number changed, how do they change that in the TELUS provider registry?
So for the fax number, they do have the option. If they're in the TELUS provider registry, the assumption is that we're going to send to them over Med Dialog. We probably wouldn't default to eFax in that situation. However, if any information changes at the clinic level, they can call us and make those changes, and we'll update them in the TELUS provider registry. We actually have updates pushed out every hour to the TELUS provider registry. So, it'll take us a little bit more to work through kind of the administrative side of things, but realistically, we can push out updates to this TELUS provider registry every hour and update that fax number there. But if it's a local clinic or pharmacy that you're wanting to fax to, you do have to maintain your local address book as well. So if they're not on the TELUS provider registry, so say like a pharmacy, you would just have to make sure you have the latest fax number entered in your local address book to send to.
Perfect. And then some questions around sending patient charts. So one question that came up a few times was, can you send just a range within the chart? So maybe you only want to send the last 2 years of chart data. Can you choose to do that?
Yeah, so we've got a different workflow that I'll be showing where you go through where you normally print the chart today from the patient chart. So I'll show that workflow in a bit, and I think there's a bit more customization there. I think from this level of creating a new message and attaching the chart, I think we're limited to what was available there, but we'll obviously work on product improvements to stuff like that based on customer feedback. So.
Okay, perfect. So those are the questions specific to this window, and we move on.
Okay. Perfect. So I'll close out of this. I'm back at my work desk here. So what I'm going to do is I'm going to pull up a patient chart and go through like a new referral process. So let me just open up the medical summary here. I'm going to open up the same patient. And I'm just going to, for kind of keep this quick, right-click and create a new referral. And so here I am in the new referral window. And so what I want to show is what we've changed here as well is when you're searching for a consultant, we've integrated the TELUS provider registry to this level as well. So there's kind of 2 different options or new options here. So I'm going to click to search by name here. And so what we've done is, like right now, this is searching your consultant list or your local address book just within what you've got on file. But we do have this new checkbox here that says include TPR, which stands for TELUS provider registry. So by checking off this box, it allows you to search for the users that are enabled for Med Dialog. So I'm going to click to check that off and then do that same search for the user that we were looking at previously. So I'll see in here, it does show my local consultant, but I have these new entries down here labeled with an @ sign. And this @ sign is kind of the representation that they are on the Med Dialog network in the TELUS provider registry. So again, these same two entries for the same user at different addresses that I can send to with that @ sign to show that they're Med Dialog enabled. I'm going to go ahead and set them as my primary. I can also add CC recipients here the exact same way. The other option I have here is using that same graphical view that I just saw in our external messages screen. So we've got this new button here that says Advanced Search. So I'm going to go ahead and click on that, and you'll see this opens up the exact same kind of graphical interface that we were just looking at. So whatever you prefer to use, they both achieve the same end result. This is just a bit more of kind of a visual way of searching. This is a bit more integrated in and kind of used to your current workflow. So you can use either option depending on what you prefer. Just to continue moving here, I'm just going to put test as a referral reason. We're not going to get very fancy with this, but just wanting to show what this would kind of look like or how the workflow looks. So I put in my primary recipient. I could add CC recipients if I'd like. I've entered my reasons. I'm going to go ahead and access our composer. Not going to send that one to MSD. And so we'll see our composer in here and the ability to make any changes and include whatever information we would like. So again, I can check off specific items and see those dynamically appear on the right-hand side here, and we'll attach. So this is what I'm attaching with my referral, obviously with the referral letter. And normally what you would do today is click print here, but you'll see that there's this new button here that says send. So again, instead of printing, we have the option then of just sending this document instead. So by clicking this button, we'll give it a second to package that up, but it's going to take that primary recipient that I specified in the last step and automatically bundle this into a PDF in full quality and give me the ability to send this via Med Dialog. If I had eFax recipients, it would show their entries here as well with the eFax icon, and it would send to some as Med Dialog and then package the rest as faxes and fax out to the appropriate fax numbers. So again, the same workflow, regardless of who you're sending to, we figure out the best way to send to them and send accordingly. So we're going to cancel out of that. And yeah, that's basically that full kind of composer that I wanted to show. I'm just going to close out of that and show our next example of eFaxing an entire chart. So from within the same patient here today, if you were going to send this chart, typically what the workflow would be to go to this print chart option. So I'm going to click that to show you the changes we've made here. So when we access this print chart option, again, we can check off however much information we'd like to add. We can specify date ranges here. This is a bit more customizable than the previous one that I was showing you. And in here, we have this new button here, which is our eFax icon. So when we're ready to send this, we can go ahead and click this icon. Yeah, I'm going to attach all. And again, this is going through and packaging this and outputting this to an eFax screen for me. So send by eFax, which is awesome. So this totally packages this together, shows me a preview of what I'm about to send, so I can confirm, yeah, it looks like it's got about the right information that I want there. I can choose who I'm sending it from, what fax number I'm sending it from. So this will go through shortly, but essentially you can have multiple fax numbers associated. So even if every single doctor wanted their own fax number, we could accommodate that, and they can choose accordingly. Or if you have multiple locations, just a lot of different combinations or possibilities there. So I'm choosing who I'm sending it from, and then who I send to, I have the option of either clicking this person to access my address book, and you guessed it, it's the exact same address book we've been looking at for the previous steps, or I have the option of just keying in a fax number. Either or, the fax number is required, so obviously when I click this person in the address book, it's going to populate the fax number down here based on what I select, but I can also just totally key in something manual if I want to. Last step here is I have the option to include a cover page. So I can, like it includes, yeah, the from, the to names, the subject, and the comment. So who it's from, who it's to, fax numbers, and then a subject and a comment that I can write in here. We're working on further improvements to this cover page. Right now it is a very simple kind of basic cover page. I can see a question already if we can have a custom cover page, and unfortunately not yet today, but that is a product improvement we're working on for kind of our upcoming versions to be able to support that. But right now, the subject and comment, we can go ahead and fill in. So that is eFaxing the full chart. Maybe I'll stop here for questions. Was there any that came in there, Amy?
One that just came in is all these new icons. Will they only show up once you're enabled for eFax and Med Dialog, or can they see them now just to kind of see what it looks like?
That's a good question. I would need to confirm that to make sure, because all the Wolf environments I've worked in have had it configured, and obviously that means the icons are there. But let me take that question away and confirm. I don't know if Ryan or Sunny, if in the chat, if they've tested that, but my thought would be that they should only appear once Med Dialog is configured and once you're registered. But we'll take a look into that and confirm that in our Q&A.
Yeah, Ryan just confirmed. He says no, they'll not be visible until you're set up for eFax.
Okay.
I don't know. Yes. And so other questions were, okay, we've had a few around sending smart forms. So if we go into the patient's medical summary and right-click and choose to send a smart form, what does that look like to send it out to somebody through eFax?
That's actually my next scenario to run through, Amy, so I will.
Awesome! What a great, yeah, let's just go there then.
Okay, awesome. Yeah, sorry, just pausing for questions just because this is a bit of a longer kind of demo and just want to make sure that we can touch on each point. So let me back out of this here and we'll take a look at that. So back in the patient chart, I'm going to go ahead and, as we said, right-click, access our smart forms. And so in here, I'm just going to keep it simple and work with a work absence form, everyone's favorite. So we're going to double-click and open this up. And here we are in Microsoft Word. So as I mentioned earlier, we have set up something called a Wolf, TELUS eFax print driver. So what I've done now is when you access a smart form, we're technically kind of leaving the work desk or leaving Wolf because we're in Microsoft Word. So when we're in here, we can't really build in kind of the send button the same way we have in the EMR because we don't have that level of customization with Microsoft Word. But the great thing that we have been able to kind of figure out and put together is putting together what's called a virtual print driver. So in here, once I'm ready to send this off as an eFax, I'm going to go to my file here and just hit print. And in my printer list, I'll have this new printer listed called eFax TELUS. So this is great because once I kind of select this and hit print, it allows me to then pull up that exact same fax window to show how to send that out. Again, I can key in a manual fax number, I can pull up the address book, I can run through all of that. So anything that leaves the Wolf EMR, so like smart forms, for example, or if there's something else that I had to send, I can do that at any point by using this virtual fax driver. And again, when you hit print, pulls up that window to either send to someone in your address book or key in a fax number. You can include the cover page, all the same information we just looked at. So yeah, that's basically how that would work with the smart form. The one last item I'll stop at and show during our demo is just the new eFax queue that we built in. So I'm actually going to go ahead and leave the patient chart. I'm no longer pretending to be a doctor, so I'm going to back out of here, exit our work desk, and to show you kind of two different screens here. So the first one I want to highlight is this eFax queue. And again, this eFax queue will show once you're enabled for eFax. It's a new button from your main screen. And when you click to open this up, it pretty much is exactly what you'd expect. It's a queue of the messages or the eFaxes that you've sent out. So your sent Med Dialog messages can be found in your external messages. Your sent eFax messages will show in this eFax queue. So in here, it'll show me all the faxes that I've sent, who I've sent them to, who it's from, when it was sent, and how many pages are there. And here's a pretty good example of like volume not really mattering. We sent a 97-page fax and it went through fine. So we definitely, have the ability to do stuff like that. Here's a good example of one that I set up just as a failed fax. Because there's no remote fax device, which means this isn't a real fax number. I sent it to 222-333-5555. So we tried to send it. It attempted a certain number of tries, but couldn't deliver because it's not a real fax number. So that got kicked back with the status of failed. And so with this eFax queue, we would recommend that clinics kind of go in here and monitor this on at least a daily basis. If the reason it failed was just because it repeatedly tried and got like a busy signal, we do have this button up here to just resend that fax. So it will then kick that back to be resent. And we'll add another entry to the top of our list here to show that that's been resent. And actually, you know what, for that one, I'll click that to show you what that looks like. Because this isn't a real fax number, it's going to fail again. But you'll see that it's archived this, so it's now italicized in gray, and it's added it to the top of my list of pending as sending. And so that has now been resent. I can view any eFaxes that I've sent, so I can see what that PDF looks like. I can also archive, which means I'm done with it. I no longer need to access it, and it's archived. We will be building out the screen a bit further to kind of show like filters and stuff like that, or the ability to sort. You can sort by any of these headers today, but we do want to add in a bit more for like filtering and options like that to better manage kind of who it's sent from and manage this a bit better. But again, product improvements are always on the way.
Yeah, that probably brings us to the one question that came about, can you filter based on user? So I guess that's not there yet. No,
unfortunately not. This is a very basic, I think the eFax queue is one of the areas I really want to focus on as we start to build out these product improvements and upcoming releases. We've kind of put enough to be functional is in here right now, but I know that once you start dealing with large volumes of faxes, this could get pretty messy pretty fast. So we definitely understand the need to build in more filtering, again, filter by user, filter by fax number, filter by statuses even maybe, just to be able to view just your failed faxes. We know that you'll need to be able to work with that. So we definitely understand that, and we'll work to build that out. I did just see a message pop up in the corner of the screen here around incoming faxes. So when you receive a fax, it comes in the exact same way a document would today. So in your documents here, this is where the faxes would come in, and they would automatically come in as a PDF available to kind of be sorted and linked. And let me just back out of here and show you kind of under configuration. There's a few other options I just want to highlight. You won't be going in here often. This is something we'll set up for you during implementation, but you do have under configuration this eFax account maintenance. So what we can actually do is create separate eFax accounts for each, again, each provider if you wanted, or each location. In our pricing, which we'll go over in a second, we do include one fax number per provider that's registering at no charge if you want. If you want to just keep it one for the clinic or two or three, that's fine. We can totally set that up. So in here, I've just got one eFax account configured, but this is just showing what number, what the name of this account is, and then down here, the number of retries in the incoming eFax folder. So we can actually customize the incoming folder based on the fax number if you wanted. So you could have separate folders for each fax number in order to kind of better manage your incoming faxes. The other thing to highlight here is the number of retries. How many times do you want to try and resend that fax before it goes into a failed status? We typically set it around 3 or 4, but that's totally customizable, you know, just to try and avoid busy signals and stuff like that. If we get a busy signal once, we'll wait, I believe it's 5 minutes, and then try and resend again. So in this case, you wouldn't get a failed until 15 minutes later because it would wait 5 minutes in between each try. So yeah, that's basically that account maintenance screen. I think that's basically everything I wanted to run through. We can associate fax numbers with locations and with providers, so you can have that set by default for each provider to automatically have their fax account assigned to them and attached by default. So that's all customizable. I think I'll stop here for just a few quick questions, but I'm just looking at the clock. I realize we'll need to get into pricing pretty quick. So was there one or two questions?
I think it's one big question that you may answer in your next slides is basically eFax. What's the benefit of the integrated eFax over other kind of solutions that are kind of eFax-ish, like, you know what I mean? So how is it different?
Yeah, so the biggest differences are that integration into your consultants, your address book. That's a huge one, right? You only need to update that in one spot, and everyone in the clinic can send to an updated fax number. So you can maintain your own consultant list directly in your EMR. You have that level of integration. You also don't necessarily need to use a virtual fax driver every single time you want to send. If you're within the EMR, for example, in the referral screen, you can click that send button and just send that off without having to click print, choose who you're sending it to, choose the recipient, and wait for it to go through that way. But we do still also have the flexibility of offering that as an option. So if you're within a smart form where you've kind of left Wolf, you have the option of sending that out as an eFax through that print driver. So a lot of kind of versatility that way. The other benefit is obviously bundling it with Med Dialog, having those two work together. There's so many benefits, including financial incentives that come with Med Dialog for e-consult fee codes, that having those two bundled together is just a great combination to leverage the Med Dialog network, but still have that fallback on fax.
Okay, I think we're ready to move on.
Cool. Okay, let me minimize this, and I'll jump back to And so, sorry, did that slideshow come right back up then, Amy?
Yep, you're back to the slides.
Okay, perfect. Just for the sake of time, I'm going to skip through stuff pretty quickly here, but just a quick briefing of this, just like kind of going over what we've already discussed. All transmissions are secure and encrypted end-to-end with eFax and with Med Dialog. We do go over e-consults, which are new fee codes for Alberta and Ontario, which I'll cover in a slideshow shortly here. Right there. Okay, so these are kind of our potential revenue options in provinces that support e-consultation, and basically we'll go over how that works with Med Dialog. So today in Alberta and Ontario, a physician can send questions about recommended patient treatment or care to a specialist or consulting physician. When that specialist responds with advice or requirements around referral being required, and that loop happens with both the request and response being sent over a secure electronic network like Med Dialog, the fee codes can be billed. So again, just repeating, the request and the response has to happen over Med Dialog, not over eFax, in order for this fee code to be billed. So this is a great incentive to kind of get both family docs and specialists on the Med Dialog network because both ends can benefit from the revenue, additional revenue for this. So in this example, we've put in 15 e-consults per month. So the referring physician would see new revenue of $5,800 per year, and the consulting physician $13,700. Again, stressing this two-way communication has to happen over a secure electronic network like Med Dialog, not eFax. But again, huge revenue potential there. In fact, for the referring physician, which we kind of expect most on the call to be, doing one e-consult per month actually covers your cost. We'll go through the pricing again in a second here, but yeah, the $32 covers your cost of unlimited Med Dialog and eFax every month. So for more information, our Alberta users on the call can refer to codes 0301R and 03010 on the AMA Fee Navigator website. For those in BC or other provinces, refer to your local ministry for timelines around these sorts of fee codes. Not available today at the time of this presentation, but we've heard lots of stuff available, kind of chatter happening around that. So again, consult your local ministry for details around that. This next slide is just going over the time savings you get with Med Dialog, comparing integrated eFax to eFax print to folder. I'm going to skip over this just in the sake of time so we have more time to discuss pricing. Quick mention, I just mentioned that we are partnering with external vendors, and so we are excited to announce our first partnership is with secure communication provider BrightSquid. So they're a secure messaging platform that operates primarily in Alberta. They support messaging between providers and even with patients. And so what we're doing is we're integrating Med Dialog to their secure mail platform so that anyone that uses BrightSquid can send to Med Dialog users, and anyone on Med Dialog can send to BrightSquid users, even though they're not on a TELUS EMR. So BrightSquid primarily targets doctors who are using paper actually, but they still want to have some form of kind of electronic communication. So it's great to be able to reach those providers using an electronic communication solution. And so even though they're not on a TELUS EMR, you can still send secure Med Dialog messages to them via the TELUS Health Exchange or via Med Dialog, sorry. We know that a lot of our EMR users are excited about secure patient messaging. So BrightSquid doesn't integrate into Wolf today, but we do offer Wolf Patient Portal. If you want more information on that, contact our sales team. Just a quick slide here, just showing our EMR mobile. So our mobile app supported by Wolf, we are working on integrating Med Dialog into this, but you can kind of view messages. Coming soon, the ability to compose, reply, and attach. Lots that you can do with the mobile app. We have over 10,000 physicians on it nationally today. Really useful for reviewing your schedule on the go, attaching pictures securely and adding those to your encounter notes. So a link at the bottom of the slide there, telushealth.com/EMR mobile messages. All right, let's get to pricing. So we offer two plans for Med Dialog service. So the first plan is our Med Dialog with eFax bundle, shown here as option 1. So this includes unlimited use of TELUS eFax Med Dialog messaging for a flat monthly rate per user, or per provider, sorry. This is our recommended plan because as we're building out the Med Dialog network, we know that a lot of the providers you communicate with may not be on Med Dialog. So having that eFax fallback is crucial. For the $30 plan, it does require all practitioners in your clinic to sign up because the unlimited usage is shared by everyone. So when we say practitioners, we're referring to MDs, nurse practitioners, and allied health professionals. Anyone else like MOAs, registered nurses, locums, residents, and support staff can all use it at no charge on behalf of those users that are registered. The second option is our Med Dialog only plan, which allows individual providers to sign up for unlimited Med Dialog messaging. This second option doesn't include eFax, so providers that choose this plan need to understand that anyone they send to is only going to be on the Med Dialog network. They won't have that eFax fallback. I think as our network grows, this may be a bit more suitable for clinics that want to keep their current faxing solution. But again, in the beginning, I think the best value is having both of those bundled together because we'll send whatever way we can, whether that's by Med Dialog or eFax. We'll send that for, $30 per month per provider. And again, just highlighting to the users in Alberta, if you send a single e-consult per month, that covers your cost of Med Dialog because the fee code you'll receive back is $32 and we're charging you $30. Another thing to note is that standalone eFax pricing is available. I can already see there's questions around that in the chat. However, our Med Dialog and eFax bundle is priced competitively to help us grow our Med Dialog network. In most cases, the Med Dialog bundle for Med Dialog with eFax works out to be a better value, and it also gives you that full resolution sending, the e-consult fee code potential, and other benefits we've discussed. But our sales team can present all options for those interested. Again, we've found the best value. We've priced this to be the best value as bundling those two services together. So if you're interested in a quote from Med Dialog, the email is on the screen there, tellussales.emrs@tellus.com. I'd also like to point out that we have a Med Dialog information website, which has videos, articles, and more information on Med Dialog. There's a contact form on that site that you can use to have someone follow up with you if you'd like. And Med Dialog is supported by the same fantastic Wolf support team you're used to calling into for questions, so they're there for support if you run into any questions. Okay, so we've got a few minutes here.
Okay, yeah, so we had a few good ones. So one of them was around communicating with other EMRs. So can they only communicate with other TELUS Health EMRs at this point, or can they go beyond TELUS Health EMRs?
Yeah, so to clarify, for our EMRs, we do only have TELUS Health EMRs on the network today. For working with other vendors, so like I know probably QHR, Accuro is one that we have a lot of people asking about. We are reaching out to have those conversations, and we're totally open to support that. Not available today, but we are working towards that, being able to send to other EMRs outside of the TELUS ecosystem. But today, MedAccess, Wolf, and PS Suite in the West, and Bright Squid is launching this summer to be able to send to those users on Bright Squid.
Okay, and also, is there a setup fee?
So you have two different options. If you would like, we do offer a consulting package. For a flat rate, you can have a kind of a trainer assigned to your clinic to answer any sort of questions and be available on call. We do have that available as a flat rate package. However, if you prefer to kind of dive in yourself and get to know it, it's not required. So if your clinic would like to kind of have someone there to walk you through everything, get everything set up and kind of configured, we'll do the basic configuration, obviously at no cost. But if you want to kind of learn the ins and outs and how to use it, we can set up that training package for you, or you can move forward without a setup cost.
Okay, and then also, okay, do you have to make a commitment for a certain number of months, or can you kind of trial it and cancel it at any time?
You can definitely trial it and cancel it at any time. There's no commitments or contracts around that. You just have to give us notice kind of thing. If your notice is given mid-month, I do believe we need 2 weeks to process it. So it depends depending on when you give your notice, we just need to be able to have time to process that, but you're absolutely not locked in. You're welcome to sign up and give it a try. Yeah.
Okay, and this is a pretty good one. Will eFax affect the EMR speed by affecting the internet and such?
No. So the great thing, well, sorry, I shouldn't say no completely. Anytime you add kind of elements to your EMR, certain things can be affected. We have done a lot of work to minimize any sort of impact. When you're sending large faxes, when you hit that send button, you may see that take a bit longer because it has to package together a large PDF. It may take a bit longer to actually send, depending if you have large faxes, but if you're doing something that's not related to eFaxing, you shouldn't see any changes in your speed in the EMR. So again, we've done as much as we can to move the heavy lifting to the background. We will send faxes in the background as much as possible and reduce any sort of impact to your workflow.
Okay, and then will eFax allow for e-signatures? So when they're sending documents and such, how does it work with physician signatures?
I don't know the answer to that on the line right now. I'm definitely happy to go back and confirm that with our teams and answer that in the Q&A document.
Okay, perfect. Okay. Oh, yeah, and Ryan said if it's configured on, say, a smart form, it will show up on the smart form, just the same way it does for printing.
Oh, perfect.
So most of everything works kind of similar to printing. You're just eFaxing instead.
Yeah.
And let's see. I think that's like a lot of them are very similar.
Okay. I do have the website up here on the screen, so that's telehealth.com/meddialoginfo. Definitely suggest heading on there. That's got information on the pricing. It's got some videos kind of showing examples. We don't have anything Wolf specific on the website because this is so new to Wolf right now. We have been kind of we've been working carefully to put all the finishing touches on this. So we'll get some Wolf information up there as soon as we can. But yeah, I'll just jump back to the pricing slide because I know people have questions and stuff. But yeah, again, $30 a month per provider for unlimited pages, Med Dialog messages available for the entire clinic. When is this available? It's available today. So we're accepting kind of signups, registration. We do have a bit of a backlog to work through, so definitely appreciate your patience as we work through that because of the high demand. However, we can definitely look at getting everything configured and set up as soon as possible.
Okay, so don't worry, we have all your questions written down here in chat, and we have them all. So if we did miss your question, don't worry, that will be answered. We will send it in a Q&A document by next week. And you will receive a copy of the recording of this presentation in about a week or so. Cool. So thank you very much, Teo. That was great.
Awesome. Thanks, everyone. Just as the last thing, I'll just put my email address in the chat here. If there's any questions, I mean, obviously we'll answer in the Q&A document, but there's my direct email. If there's anything kind of complicated or specific, feel free to reach out to me, and I'll do my best to help or get you in touch with the people that can. Thanks, everyone.